According to the World Health Organization, today about 10% of the world's population suffers from diseases of the renal system. At the moment, there are over 120 dialysis centers in Kazakhstan, including the network of nephrological centers of one of the leading companies in the country, B.B.NURA.
The B.B.NURA network of nephrological centers began its history in 2011 in the city of Karaganda. After 10 years, we turned into a network of nephrological centers. At the moment, we have more than 1,000 patients who are receiving treatment.
Today, B.B.NURA provides a full range of nephrological services in Kazakhstan. The main goal of the nephrological centers is to provide comprehensive care and support for patients with various kidney health conditions, from prevention to transplantation and dialysis. Operating since 2011, B.B.NURA has already opened 21 outpatient dialysis centers. Today, they work in 9 major cities of our country and also in small towns and villages.
В 2019 году такой пик нашего этапа жизни мы решили провести реформирование.
In 2019, at the peak of our company's life, we decided to do a reform. The reform began with medical staff. We have divided our staff into doctors who provide treatment. These are nephrologists and doctors who provide high-quality dialysis in the whole. One patient is surrounded by care from a nephrologist, a dialysis doctor, a head of the center, a regional medical director of the city, and myself, the head of the department. We also have independent medical experts. The patient is cared for by 5 to 9 professionals. We conditionally divided the middle personnel into qualifications, the first, second, third, respectively. The highest is the first qualification, where the employees possess not only the skills of the dialysis program, but also the methods of ultrasound examination of the artery of the venous fistula. They can also provide the initial resuscitation and work in all departments of the nephrological center.
Работать во всех отделах нефроцентра.
From the very beginning, the priority for B.B.NURA has been to provide patients with the best possible service. That's why the world leader, the German company B. Braun Aviram, is the strategic partner of the company in the field of dialysis machines and consumables. Patients have access to food service and transportation. For comfort, a mobile application with convenient functionality has been developed where you can view the examination data of procedures, various useful information, keep a self-controlled diary, and a schedule for receiving procedures. The company has the appropriate certification and provides all consumables, medicines, and diagnostic services in accordance with the approved legislation of Kazakhstan in the field of standardization of dialysis services. Since 2017, B.B.NURA has begun to expand the range of its services. Today, 4 round-the-clock inpatient departments of afferent therapy have already been created, on the basis of which the emergency service operates 24/7. Specialists provide qualified, urgent care for critically ill patients anywhere in Kazakhstan. With the help of air ambulance, doctors carry out trips to remote regions of the Republic. Today, B.B.NURA afferentologists can be found in almost all resuscitation and intensive care units in Kazakhstan. B.B.NURA doctors use innovative methods of therapy in their work, for instance, hemisorption technology and extended procedures of renal replacement therapy. For this, the company purchased the latest development in the field of afferent therapy, the Omni device. Today, 6 of such installations are in the intensive care units of Shymkent, Astana, and Semey, which help doctors, among other things, save lives of seriously ill patients with COVID-19.
В плане оказания афферентной терапии наша компания, по сути...
Since our specialization is very narrow, our organization accumulates this experience every day. At the very beginning, the number of patients was not so big, and we managed our work with 1 or 2 specialists. Today, the number of patients increased significantly. Of course, we had to expand our team. There was a need to open similar hospitals in other large cities and regions.
Since 2019, in order to improve nephrological care for the population, the B.B.NURA company has taken a course to gradually solve these issues in Kazakhstan.
В феврале 2019 года в компании открылся отдел нефрологии.
In February 2019, a nephrology department was opened in the company. The department provides consultative and nephrological assistance in terms of preventive measures for the progression of chronic kidney disease to the population. The company's specialists provide advice at the polyclinic level with preventive screenings, explanatory information activities for the population about the problems of the disease. Day patient facilities have been formed and opened in major cities where patients receive treatment aimed at solving the progression of renal pathology.
Прогрессирование болезни почек.
15 nephrologists conduct more than 500 consultations every month and form a huge database.
80% из всех консультаций
80% of all patients are diagnosed with chronic kidney disease, while the majority of them are at the first and second stages of the disease. Competent analysis is required, as well as the necessary medical information system.
Since the end of 2016, we have started to develop a medical information system. Before that, it was just registration and discharge of patients. Now it is a large network of analytical data. It is such a working machine that allows us to carry out our reforms further. Our nephrologist is currently treating up to 120 patients. At the same time, he's engaged in parallel consultations. The medical information system gives us a big breakthrough. I can review patients' condition anywhere in Kazakhstan.
One of the important stages in the development of the company was the creation of the Register program, a program that helps specialists to competently form a record of patients at risk, monitor and provide timely assistance to patients with chronic kidney disease, regardless of their place of residence.
Основной целью и задачей регистра является
The main goal and task of the register is to timely notify specialists, regardless patient's amount, when who needs help, at what stage. Also, this program helps us form a confident prediction of the progression of this pathology in a certain region. In 2019, B.B.NURA opened its educational center to train competent specialists in the field of afferent therapy and improve the qualifications of medical personnel. Initially, it was created for the internal needs for the company, but today, specialists from other medical institutions in Kazakhstan have begun to train in the center.
Несмотря на то, что на общем рынке
Despite the fact that there is competition in the common market, we're still working towards a common goal. Of the companies that currently provide renal replacement therapy services, we're the only company in Kazakhstan that has educational center.
вообще в Казахстане.
Simulation classes are equipped with innovative machines. The main goal of the center is to train medical personnel, therefore there are many specific dummies here. There is a unique robot of the 6th simulation level, the pride of the educational center. It helps students develop critical thinking since it can imitate breathing noises, heart sounds, convulsive syndrome, and even neurological status.
На сегодняшний день вот именно
Today there are only 3 units of such equipment in Kazakhstan. In the world there are only 750 of them. Based on this dummy, we've already created clinical scenarios.
сценарии.
All the work of the resuscitation team with the robot is filmed. As a rule, the patient is resuscitated within 15-20 minutes, and after, the medical team holds debriefing. The company has its own service department for its equipment and buildings. That's why not only medical specialists are trained here, but also technical engineers. The B.B.NURA team are not just nephrologists and experts, they're also reliable partners, advisors, people who strive to help patients with difficult diagnoses to regain control over their lives, which usually seems to be lost forever. How can someone enjoy life when he is diagnosed with chronic kidney disease? How to improve its quality? The professionals of the B.B.NURA company surely know the answers to these questions.